Assalamualaikum and very good morning. My name is Mastura Binti Abdul Majid, a student of Bachelor of Nursing Science with Honour and now in semester 5, May 2020. This video is to fulfill the assignment of OUMH1303 and my metric number is 7904150251700001. Today, I'm going to deliver a persuasive speech on being an organ donor and mainly will be focusing the needs constantly growing for organ donor, and it is very simple to be an organ donor. Why it is important to be an organ donor? Donation is the gift of organ and tissue to help someone who needs a transplant. Transplant can save or change a person's life. One organ and tissue donor can help transform the life of more than 10 people. This relies on donor and their family agreeing to donate their organ and tissue after death. Organ or tissue donation is a noble practice. It is not new in Malaysia, as it is a treatment method that has been accepted in our country. The number of patients who need an organ transplant is increased from year to year, but the number of the pledges who want to donate after death is low. In 1999, the organ donor card was launched as an indication of a person's registration as an organ donor. Until now, it is estimated that over 126,000 donors have been recorded in the National Transplant Resources Centre. This number is very low compared to the population of approximately 27 million people in this country. The National Transplant Resources Centre was established not only to increase the number of the organ donor, but also to raise the public awareness and to provide information about the importance of organ donation. Situation of the organ donation in Malaysia, 25,000 is still waiting for the kidney transplant. Number of the kidney patient is increased by 1,000 each year. Only 424,000 people have pledged to be an organ donor, only 1% of the total population. Importance of the organ donation is one organ donor can save the life of 8 people. Organ donors are on the priority list of the medical attention in Malaysia. What organ and tissue can be transplanted? Organ and tissue that can be transplanted include liver, kidney, pancreas, heart, lung, intestine, cornea, middle ear, skin, bone marrow, and also the heart valve. Who can be an organ donor? People of all ages should consider themselves a potential donor. When a person dies, he or she is evaluated for donor suitability based on their medical history and age. The Organ Procurement Agency determines medical suitability for the donation. Today, I would like to talk to you about the need for organ donor in our country, how the recipient organ donor benefit from your donation, and how you become an organ donor today. The organ waiting list continue to grow. Every day, there are approximately 114,000 people on the waiting list for an organ. Approximately 10 additional people are added each day. One organ donor can help multiple people. One organ donor has the potential to save 8 lives, save or improve as many as 60 lives, and enhance the eyesight of 2. Living donor feel a crucial need. A living donor can donate a kidney or a portion of their liver to a friend or family members, or even altruistically, and continue to live a normal life with very little restriction. People waiting for the kidney transplant make up more than 80% of people on the organ waiting list, and people waiting for a liver transplant make up approximately 12%. People are dying while waiting for an organ. Approximately 20 people die each day while they are waiting for an organ match to undergo a transplant. Organ donation can be a rewarding and positive experience. It can help a family work through the grieving process and deal with their loss by knowing their loved one is helping save the life of others. There are no age exclusion to donate. If you are otherwise healthy, many of your organs could still be viable for an organ donation. The transplant surgeon evaluates the organ and decides whether they are suitable on case-by-case basis. Very few medical conditions disqualify you from donating your organ. It may be determined that certain organs are not suitable for transplantation, but other tissue and organ may be fine. Simply put, a disease is one organ does not preclude other organs from being donated. Most religions support organ donation. This include Catholic, Protestant, Islam, and most branches of Judaism who see it as the final act of love and generosity towards others. Now that you see the great need for organ donor in our country, let's look at what may happen if you choose to donate your organ. For the recipient, quality of life, transplant can greatly improve a recipient's health and quality of life, allowing them to return to normal activities. They can spend more time with families and friends, be more physically active, and pursue their interests more fully. Increased lifespan, a kidney transplant dramatically increased the lifespan of patients by about 10 years and improved their quality of life. Dialysis, while clearly a life-saving treatment, it is a less than perfect replacement for an actual human kidney. In addition, people who undergo a transplant will no longer require weekly dialysis treatment or have the side effect of dialysis such as nausea, vomiting, low blood pressure, muscle cramping, and itchy skin. Due to the lack of organ available for transplant, patients who on the national transplant list often face long wait time, sometimes several years, before they are able to receive a transplant from a deceased donor. Patients who find a suitable living donor do not have to wait on the list. Transplant candidates generally have better results when they receive organ from living donor as compared to organ from deceased donor. Often, transplanted organs from living donor have greater longevity than those from deceased donor. Genetic match between living donor and candidate may lessen the risk of rejection. A kidney of the liver from a living donor usually functions immediately in the recipient. In uncommon cases, some kidney from deceased donor do not work immediately, and as a result, the patient may require dialysis until the kidney start to function. For the living donor, the gift of an organ can save the life of a transplant candidate. The experience of providing this special gift to a person in need can be a positive aspect of donation. Donating an organ can increase the time you to spend with your loved one as well as the quality of that time. For both the recipient and living donor, surgery can be scheduled at the time that is convenient for both the donor and recipient. A living donor removes a candidate from the National Transplant Waiting List, which is currently about 114,000 people. This allows the people on the waiting list who cannot find a living donor a better chance of receiving the gift of life from a deceased donor. The impact of a transplant is so striking that recipient often look noticeably healthier as soon as they emerge from surgery. From this From this statistic display the result of the survey asking individual about the willingness to donate organ in case of sudden death in Malaysia in 2018. According to the data, about 50% of the Malaysian respondents claimed they were willing to donate organ to help others in need, while around 20% did not consider donating organ. Through my experience as a nurse, I have attended the course of organ donation in Hospital Sultanabaya. After the course, there was an awareness of the importance of organ donation at this time. I had the opportunity to interview the family of the donor whose son was confirmed brain dead after the accident. Her son is only 22 years old. 2 weeks before the accident, her son had told his mother about his desire to be an organ donor and he had voted to be an organ donor. After being approved by the doctor that her son suffered brain death and was asked by the doctor about organ donation, then his mother remembered his son wished to donate organ. At first, there was opposition from close family, but the donor's parents still fulfilled his son's wish. Parent request to the hospital so that the body should be in the good and perfect condition after the organ is taken. This is to avoid the public humiliation of the donated organ is not sufficiently described the nature of the bodies. The donor family hope that the recipient of the organ can take advantage of it. They also feel happy to be able to help people out. So, here, how you can register to be an organ donor? By fill in the online registration, and if the registration is successful, Derma Organ will send over your organ donor pledge card within 3 weeks from the date you registered. Once you receive it, fill in your personal information and sign at the back of the card. Keep it with you all the time and make sure that you notify your family member about your status as an organ donor. Number 2, you can fill up the organ donation registration form, print and send it to Pusat Sumber Transplant Nasional. You also can visit the National Transplant Registry and fill in the form. If you are below the age of 18, you will need your parents or guardians' consent to be an organ donor. Also, registering as an organ donor does not require any payment or health screening. Finally, I sincerely hope I can convince you of the importance of donor, explaining the benefit of being one, how organs are used, and also how you can be a donor. I also hope that I have convinced you to talk to your parents or loved one and tell them about your wishes. Let us all realize ourselves with the infinite variety of divine gift and favor to us. Among the benefit of limb, health, and others, grateful for blessing by appreciating them and sacrificing for Allah subhanahu wa ta'ala for the benefit of the universal ummah. May we always get madatillah in our daily life. Amin. Thank you for watching this video. Bye. Have a nice day.